Direct-to-Consumer Advertising of Pharmaceuticals is Not Bad for Health by Samantha Mitchell. Direct-to-Consumer Pharmaceutical Advertising, or DTC-PA, is an effort made by pharmaceutical companies to promote their prescription products directly to patients, usually via popular media. The United States and New Zealand are the only two countries that allow this type of advertising that includes product claims. Direct-to-consumer pharmaceutical advertising has grown very rapidly over the past several decades and is now the most prominent type of health communication that the public encounters within the United States. Although there are critics to this type of advertising, research suggests that it can be beneficial within a number of respects. There are three types of direct-to-consumer advertisements. These advertisements cover both prescription and over-the-counter products. The first type is product claim advertisements, which is the most common type. This ad mentions the product by name and makes claims on its effectiveness and its safety. The second type is the reminder advertisement, which can include a product's name. This ad may also mention information about the product, such as the strength or dosage form. However, this ad cannot make any claims about the product. The last type of advertisement is called the help-seeking advertisement, which only provides information about a medical condition and encourages patients to contact their physician. This ad does not make any mention of a product name or any claim about products. There are many different avenues used to distribute direct-to-consumer advertisements. The most common include television, print such as magazines and newspapers, radio, the internet, and other forms of mass media, including billboards and direct mailings. Promotional brochures that are supplied to healthcare professionals, which are then distributed to patients, are also considered direct-to-consumer pharmaceutical advertisements, although they are not provided directly to the consumer by the manufacturer. Many companies are recognizing the enormous potential of online direct-to-consumer pharmaceutical advertising, which reaches millions of potential consumers globally. However, the vast majority of the DTCPA budgets are still being used for traditional media marketing. The FDA's Division of Drug Marketing, Advertising, and Communications is responsible for the regulation of DTCPA. The FDA was given the authority to approve pharmaceutical products for marketing in the U.S. as a result of the Federal Food, Drug, and Cosmetic Act passed in 1938. In 1962, Congress granted the FDA sole authority to regulate prescription drug labeling and advertising, and in 1969, the FDA issued final regulations regarding prescription drug advertising. These regulations stated that ads must not be false or misleading, present a fair balance of information about risks and benefits, include facts regarding the advertised use, and include a brief summary that mentioned every risk described within the product's labeling. A cultural shift occurred in the 1980s in which patients started to actively participate in medical decision-making along with their healthcare provider, which led to an increase in DTCPA. In 1981, Merck ran the first DTCPA print advertisement for an anti-pneumococcal vaccine. In 1983, Boots Pharmaceuticals ran the first DTCPA broadcast advertisement. Because of the increase in DTCPA, in 1985, the FDA claimed regulatory jurisdiction over DTCPA and decided that prior standards established for advertising to healthcare providers were sufficient to protect consumers. Since companies have to include complete information about risks from prescription packaging when doing a product claim ad, It was impossible to do these as a broadcast advertisement. However, in 1999, the FDA issued final regulations that allowed broadcast DTCPA product claim ads to include a shorter risk summary and had to direct viewers to access more information. In 2004, the FDA further relaxed their regulations concerning DTCPA by allowing print ads to have more simplified brief summaries of risks so that consumers could better understand them. There are a number of arguments that can be made in support of direct-to-consumer drug advertising and its benefits to health. All three types of direct-to-consumer pharmaceutical advertisements educate patients on different information regarding pharmaceutical products and/or illnesses, which allows them to have a better understanding. This new information may in turn empower patients to gather further information on their perceived illness. This empowerment may help make patients feel as though they are taking charge of their own healthcare. The way in which they gather information may be from their physician or from the internet. In a study done in 2005, many adults indicated that although their physician was the most trusted source of information, they still went online before consulting their physician. Online direct-to-consumer pharmaceutical advertising or pharmaceutical company-sponsored websites can be used to inform patients by communicating safety risks and public health information. DTCPA promotes patients to consult a healthcare provider to seek medical advice. A study done in 2004 by the FDA found that exposure to direct-to-consumer pharmaceutical advertisements prompted 27% of Americans to make an appointment with their doctor to talk about a condition that had not previously been discussed. And an additional study found that the small print in an ad was associated with patients contacting healthcare providers. This content is very beneficial in promoting dialogue about improving the patient's health, whether or not a drug is prescribed. In the same 2004 survey conducted by the FDA, 53% of physicians said that DTCPA led to better discussion with patients and that 73% believed that it helped patients ask more thoughtful questions. This type of advertising may also promote a heightened awareness to adverse reactions, which can also lead to discussions with a healthcare provider. Data also suggests that although patients may have discussions with their doctor prompted by DTCPA, it does not always benefit the manufacturer of the advertised drug because physicians do not usually prescribe a medication simply because it is requested. Participation in decision-making of a patient that has previous knowledge benefits the patient-clinician relationship. Ads also reinforce patient-clinician relationships because they focus on patient communication, promote dialogue with the physician, and place the doctor in control. The small print within an ad also encourages patients to seek advice from their doctor. DTCPA helps to improve patient compliance with drug regimens and also increases the likelihood of having patients get their prescriptions reordered. Exposure to these ads encourages patients to take an active role in their health care, which empowers them to follow their prescribed regimen more accurately. It is also believed that drug ads serve as a reminder about patients' medical conditions and their prescriptions, as well as reinforces physician recommendations. DTCPA can improve public health by enhancing patient perceptions about conditions that could be medically treatable and get them treated in a timelier manner. In that 2004 FDA survey, it was also found that this advertising improved underdiagnosis of illnesses, since 88% of patients who had inquired about a medication in response to an ad actually had a condition that medication treated. These ads also encourage patients to disclose health concerns, particularly with undertreated conditions, because they recognize more symptoms that can be attributed to these illnesses. Consumer drug advertising for health problems that could be embarrassing to a patient can also reduce the stigma associated with these conditions. Advertising normalizes these conditions and allows these patients to know that they are not alone. Also, advertising campaigns may raise awareness of medical conditions that patients have been reluctant to discuss with their doctors. Minority populations may benefit greatly from the education prompted and provided by DTCPA. This advertising can empower these individuals to advocate for their own health and well-being, as others may not be doing so. DTCPA also encourages those of a low socioeconomic status who may not receive regular medical checkups to seek out medical care. Drug advertisements stimulate increased competition in the marketplace, which may lead to a lower price. DTCPA also encourages early awareness of certain conditions, resulting in cost savings from avoiding more expensive surgical interventions that may come from an untreated diagnosis. Further, DTCPA prescription drug ads create revenue for pharmaceutical companies, which can in turn be used for further research and development of new and potentially life-changing drugs. In conclusion, direct-to-consumer pharmaceutical advertising has grown very rapidly over the past several decades and is now the most prominent type of health communication that the public encounters within the United States. Although there are critics to this type of advertising, research suggests that it can be beneficial to a person's health within a number of respects. To maximize the positive effects of DTCPA, information must be accurate and should be designated to educate the consumer and refer patients to healthcare professionals. Healthcare providers should also recognize that patients are increasingly seeking information through multiple channels regarding new therapies and be prepared to discuss these as a part of the consultation. For more information regarding this topic, please refer to the references listed on this page.